CHaRA, Construction Health and Relief Acts around
CHaRA,
the globe,
Construction
helping you
Health and
help
Relief
others.
Acts around the globe,
Small children,
helping you help others, small children. CHaRA, extending hands, embracing, caring for, loving all impoverished children, fulfilling dreams, directly funding humanitarian efforts, saving lives throughout the world. Let CHaRA help you meet your personal and corporate humanitarian partnership goals.
poverty is not natural. It is man-made and can be overcome. Overcoming poverty is not a gesture of charity. It is an act of justice. Sometimes it falls upon a generation to be great. You can be that great generation. Let your greatness blossom.
Your donor funding results in new orphanages, schools, life skill education, disease control seminars, medicine, hospital equipment, freshwater wells, treated mosquito bed nets, dental care, medical personnel, and construction teams. But let's get right to the African disease issues by having the CHaRA staff share some interesting and frightening statistics.
Well, let me read just a few off their list. Its population is about 36 million. Astonishingly, half are under age 15. The average life expectancy is only age 36. Over 2 million Tanzanians are living with HIV/AIDS. 19 million suffer from malaria annually. Every 5 minutes, a pregnant mother or child aged 5 or under dies from malaria. The number 2 killer of Tanzanian children is, believe it or not, preventable medical issues like diarrhea, due to a lack of fresh water and unsanitary living conditions.
A major issue in poverty-stricken Tanzania is the lack of clean water. The average American uses 75 gallons of treated water each day. In parts of Tanzania, an average family of 5 or 6 have 1 5-gallon bucket of water available to them per day, and many times it's untreated. The issue of water also adversely affects the educational opportunities for Tanzanian girls. Forced to be water carriers to help their families financially, they often have no time to attend school.
Of the 113 million children in the world not enrolled in school, 60% are females. In Tanzania, that figure is closer to 75%.
I knew African children were extremely vulnerable to many diseases, but I truly didn't know how the lack of water, unclean water, and poor sanitation present such challenges, especially how they are at the root of so many health problems, and how they affect young girls' opportunities for education. Children who escape deadly disease may face other challenges. It's estimated that by 2010, Tanzania will have more than 3 million orphans.
Don't forget Africa, because our children are dying here. Not because we are doing nothing, but our resources are very, very limited. Our income is very, very limited. The malaria is killing many people than AIDS here, because in 1 week time, a baby is gone.
As a leading industrialized nation, a common body of so many races, creeds, and beliefs, we cannot ignore these impoverished people. Each one of us, as an individual, a group, or corporation, can impact a child, a village. Sometimes it just takes one approval, one click of a pen, one yes.
Yes.
Find out more about malaria prevention by visiting our CHARAmission.org website.